Hi, I'm Louise. I'm here today with Liza, who's a clinical coordinator at U.S. Renal Care. Liza, what is a clinical coordinator?
Okay, clinical coordinator. By title, I'm a registered nurse. So I'm in the management, and there's a facility administrator above me. And so most likely I do the clinical outcomes, make sure that we're meeting all the outcomes that the Network 17 or the government are requiring. So we make sure that those are all meeting the goal. If not, then we have to coordinate with the staff and make a plan of action, how to meet it and how to achieve the goal. Mm-hmm.
And so what kind of outcomes are you looking at?
So we are looking at clinical outcomes like the anemia management, adequacy of dialysis, the access where patients put the needles during treatment, and then also we look at into the nutrition, the bone management, phosphorus management, and their dietary management. And also we need to make sure that patients are compliant to treatment.
Okay. Mm-hmm. So you also work directly with patients, correct?
As far as direct patient care, we have the PCT, patient care technicians, that do the treatment. They put the needles, and then they have 4 patients, and they are, or all these PCT are monitored by or supervised by the registered nurse.
Okay.
So each registered nurse will have the direct patient care and the PCT.
Okay.
So most likely I do most of the management, and like I said, looking at the outcomes and mostly, running reports to achieve outcomes.
So do you review patient charts when they start dialysis?
What I do is we have a report that we can run in our computer in the EMR. So I don't individually review each patient, but I review them when they're coming for an admission. So I look at their history and physical, their labs, and all of the insurance I have to review. But during the monthly, when they come here for like 15-day treatments, we run their report, and I believe we have 206 patients at this point, we run a random report for all the patients. So what we do is we look at outcomes, and who has the outliers, we review the charts.
Okay.
So not every individual chart that I have to review.
So when patients are doing well, you're
right.
reviewing their
Yeah, we don't have to review their charts. And what we do too, we have RNs like Jackie. She has a special assignment, like she manages anemia for the entire unit.
Oh, okay.
So we work as a team. So all the RNs have special assignments.
You said for new patients you review insurance.
Yes, we also look at the insurance, if they are authorized, and if they have health insurance.
Okay.
Yes.
So what happens if the patient's information is either they're lacking insurance or they don't have all the labs they need?
Okay, so then I review, and whatever is missing, I have to escalate it back to admissions, and mostly the corporate admissions and the local admissions has to look and ask for records from the PCP or whoever is referring.
Mm-hmm. Mm-hmm. So are you a person who can tell me about responsibilities that the patient has during
Yes.
their dialysis?
Yes. There's a lot of patient's responsibility, and this is very important to lay on admissions to make sure that they understand their rights also, and responsibilities. So yes, they have a lot of responsibilities.
And who discusses that with the patient?
Social workers.
The social
Yes.
workers do. Okay. So can you give us maybe the top 3 responsibilities as you see them?
Okay, so I'll read it. I'll read the first 3. It is the responsibility of the patient to cooperate and comply to the best of his or her abilities with the diet, medication, and dialysis regimens, and for self-care between treatments. So that's the first responsibility. The second responsibility is it is the responsibility of the patient to comply with facility rules and regulations, which have been developed to protect the patients, ensure safety, and afford quality care for all patients. The third one is the patient is responsible for learning as much as he can or she can about kidney disease for its treatments.
Okay. So do you ever have patients who cannot comply with the
Yes.
responsibility? And what happens
Yes.
then?
So that's I'm looking at their.
It's because it's a
here.
lot of stuff.
There's a lot, and there's a lot of responsibility that they forget. So, like a respect for the staff and others. So if we have patients that has behavior problems, we discuss it as a team, and we have to review the rights and responsibility again, make sure that they understand. We have to reinforce it.
Does it ever happen that a person no longer gets dialysis because they can't comply?
So far, we've been pretty good with making sure that the patients are compliant to their rights and responsibilities. So far, we have not discharged anyone because of that. Thank God for that.
Yes, definitely.
Yes.
And so this is, the patient discusses this long document with the social worker, and do they sign it then? Is
They
this
sign
an
it.
agreement?
Yes, it is an agreement. And they usually have a separate form to sign.
Okay.
Yeah.
So that must be somewhat daunting when someone didn't know they had kidney disease and sort of crashes into dialysis.
Exactly.
And so they've got all sorts of new things in their life.
Yes, that's the reason why we have to make sure that they understand there's complications during treatment. They have to, their lifestyle has changed because they have to come 3 times a week here. So it's a lot of change in their lifestyle.
Yeah.
Yes.
Okay. Is there anything else you would, part of our goal is to educate patients and families about the realities of dialysis. Is there any advice you have for them?
So I've been in dialysis for, I will say, more than 20 years. And a lot of it is a patient to comply, because the longest patient that I remember in dialysis was about 30 years.
That's a long time.
So, as long as they comply with the doctor's regimen, any diet regimen, they have to comply, take medications, and they should be fine.
You have an RN degree.
Yes.
How did you get into dialysis care from school?
Okay. So I came from the Philippines, and I finished all my schooling there. I had a 5 course of Bachelor of Science in Nursing. Before I can even take the NC NCLEX exam, that's the RN certification, I have to take English proficiency exam equivalent to 12th grade. So once you pass that, then you can apply for the NCLEX exam, and then you challenge the RN exam, and that's how I got into the dialysis.
So how long did that take to get through those exams in the U.S.?
So I did take, as soon as you get the English, so that would say 3 years. Then once I passed there and I still work in dialysis, but I had to go to an acute facility to get more skill.
Okay, so and how do you like the work?
I love it. I love it, yes. A lot of, they think dialysis is kind of simple, but there's a lot to learn. And it is, what I mean is as time goes by, there's a lot of modern practices that they have to implement.
So what's your favorite part of the job?
Dealing with patients. So, patients are easygoing, some are hard, but majority of them are good. They're easy, yes. So I love it. Yeah.
Okay, well, thank you so much.
Thank you so
for telling us
much.
about